The Pediatric Activity Card Sort, or PACS. PACS is an occupation-based, client-centered, self-report assessment tool comprised of pictures of children engaging in the typical occupations and activities of childhood. It is designed to help determine their levels of occupational performance and engagement. Pediatric occupational therapists can also use the PACS for goal setting and intervention planning. PACS is an assessment that can be used to identify occupations that a child is currently doing, to identify occupations a child wants to, needs to, or is expected to do, as a research tool to identify occupational patterns in children with and without disabilities. These are the materials used for PACS. PACS manual, score sheet, and 83 PACS cards. The pictures of children performing the various activities may prompt the identification of other activities not listed on the card sort, so blank cards are provided to capture the other pursuits in which a child may engage. Next are the following steps in using PACS. Explain to the child that you are going to show him or her some pictures of children doing various activities and that you would like to know whether he or she engages in similar activities. Present the activity cards to the child one at a time and ask if he or she has participated in the activities shown in the last year. If the child responds yes, ask him or her to place the card on the yes label. If the child responds no, ask him or her to place the card on the no label.
Charlie, I am going to show you some pictures of children doing different types of activities. I want you to place the picture in the yes column if you do this activity and in the no column if you do not participate in the activity. Do you understand?
Yes, I understand.
Okay? Would you like to participate in this activity?
Yes.
Charlie, do you like to participate in this activity?
No, I don't.
Okay. So for everything.
Yes.
Do you want to participate in this activity? No? Okay.
If the child has difficulty focusing, place all the cards upside down in reverse order and present them to the child one at a time.
What's next? No, Charlie. Let's focus, okay? Okay, let's proceed. Do you do this activity? Would you like to do the activity? Okay, let's place it here.
At the end of each category, a blank labeled Other is included to encourage the child to identify additional activities not depicted in the photographs. If you prefer, you can sort the cards into piles by activity frequency by asking the child how often he or she participates in the activities shown. 4 cards titled Daily, Weekly, Monthly, and Yearly are included. There is a box on the scoring sheet to record the response by placing a check mark in the appropriate column.
Do you do this activity?
Yes.
So how often do you do this activity? Daily, weekly, monthly, or yearly? How often do you do this? Daily? Do you want to do this activity?
After you have shown the child the entire card selection, ask him or her to identify 5 activities most important to him or her, and 5 activities he or she would most like to do. Record these activities on the PAX scoring sheet.
So Sally, of all the activities that you have seen, what are the most important to you? Big five.
Going to
Okay. One more. Now, pick 5 activities that you want, that you think you would most like be able to do. Three more. Last one.
The PAX scoring sheet is used to calculate total activity participation in each of the 4 categories, to identify most important and desired activities, and to create an occupational profile. The total scores reflect the child's activity level prior to therapy, and this information can assist you and the child in identifying meaningful occupational goals to be addressed during the therapy.
The score prior to treatment provides an occupational profile of the child's participation before therapy and describes the child's participation summary. The scores obtained following intervention reflect new occupations that will have been added to the child's repertoire. The percentage change prior to therapy versus following therapy can be used to indicate the child's pattern of engagement longitudinally.